Now we are going to go on to the CAPS 5, and describe the key components of this clinically administered instrument. If you have a copy of the CAPS 5 instrument currently, it may be helpful to have it out and review it as we go over it. Additionally, there is a completed lifetime events checklist, or LEC-5, that I'll refer to as well. It's been completed ahead of the class so that you may use it with your practice subjects later on today. Please feel free to ask for the video to be paused at any time so that you can ask any questions. The CAPS is the most widely used clinician-administered structured interview for diagnosing and measuring the severity of PTSD. Prior to the CAPS, most clinical interview instruments ask clients to respond to whether or not symptoms were present using a simple yes-no response. The CAPS gets at both the frequency and intensity of the symptoms that the client is reporting. This information is used to determine the level of severity of the symptoms, and I have also found it useful in focusing treatment planning with the client later on. The severity scales can help to target and prioritize the most problematic symptoms during the safety stabilization phase of the phase-oriented approach to trauma therapy. As mentioned previously, the Lifetime Events Checklist, or LEC, can be used to establish criterion A across 7 predetermined items. Each item is a potentially traumatizing event that may have occurred within the client's lifetime. There are 3 versions of the Life Events Checklist. The standard version. This can be self-administered, with the client completing it privately. The client checks at least one box for each event and indicates whether the event applies to them or not, and if so, the nature of the exposure. Did the event happen directly to the client? Did they witness it? Did they learn about it? Did it occur as part of the job? Are they unsure about whether or not the event definitively did or did not occur? And finally, they can check if it does not apply to them. The LEC interview version is a 12-page interview that is administered to the client. This version includes the same 17 traumatic events, but goes into detail by prompting the interviewer to ask follow-up questions for any positive response to any of the events the client reports that occurred to them. This is a more exhaustive version and may need to be administered in its own time, completely separate from the CAPS 5. The extended version of the LEC includes the 17-item checklist of potentially traumatic events, plus follow-up questions to help the interviewer determine if an event or a group of events satisfies the definition of a traumatic event. For any of the previously mentioned versions of the LEC, whenever the clinician is administering the LEC, it needs to be introduced by explaining the purpose of the checklist, and the instructions at the top of the LEC need to be read as they are written. When completing the LEC, sometimes a clinician will see that the client checked that multiple events had taken place. Prior to beginning the administration of the CAPS, the clinician needs to identify with the client what the worst event was. This event will be used as the index event later on in the CAPS. So at any point in the CAPS, when you see worst event or index event mentioned, that is referring to the event that you determined with the client that was the worst event for them. That event will be used throughout the duration of the CAPS 5. Also, as mentioned initially, there are 3 versions of the CAPS 5 corresponding to different time periods: the past week version, the past month version, and the past month or worst month versions. The past month or worst month version, which we are using today, can be used to assess the severity of PTSD symptoms for any 30-day period over the course of the participant's lifetime, during which his or her symptoms were the worst. This version is the best for establishing a lifetime PTSD diagnosis. You can also, by using this version, determine whether or not they have a current diagnosis if they reported that the symptoms were also active the past 30 days. So, for the purpose of practicing the CAPS administration today, you will have an LEC-5 standard version checklist that will be pre-filled out and that will help you establish criterion A in the CAPS. And you will have a blank new CAPS 5 past month, worst month version to use during administration of the instrument to your subject. It comes as no surprise that discussing traumatic events and the impact they have had on the person can be distressing. There are some essential skills that should be considered when administering any trauma assessment, including the CAPS. As with any instrument administration, it is exceptionally true that it is important to develop rapport with the client and maintain an effective alliance throughout this particular trauma assessment, as discussing trauma is globally a very difficult thing to do. A supportive and encouraging interview tone is essential, in addition to discussing matters of privacy and confidentiality, especially due to the sensitive subject matter. You can also ask the client about any concerns they may have before getting started and addressing these concerns off the bat. Let the interviewee know that there are no right or wrong answers and encourage them to give specific answers to specific questions. While specificity is encouraged, it is also important to facilitate this instrument while maintaining structure and keeping the interview moving along, as it can be distressing for clients who spend too much time discussing any particular symptom that has to do with a traumatic event in their life. In terms of the interview structure, let the client know that the length of the time it typically takes to complete the CAPS is about 35 to 45 minutes, although as previously mentioned, it can take up to 60 minutes if the client takes their time or you have to attend to them if some of the questions become a bit too distressing. The purpose of the findings must also be disclosed to the client. For example, if the CAPS 5 will be used for treatment planning purposes later on, for clarification of a PTSD diagnosis, or for a disability determination, etc. And again, informing the client of potentially stressful experiences while encouraging them that the stress may pass is essential when introducing the CAPS 5. Let them know to keep open communication with you throughout the administration of the instrument, and remind them of their right to withdraw consent at any time if they notice that the experience is becoming too distressful for them to continue.